Hi there. This week I am recording on a 65-year-old female who was actually unable to participate in the interview due to her confusion and her sedation status in the MICU. Upon entering the room, she was sleeping, appeared annoyed when I attempted to wake her, but she was able to wiggle her toes and move her hands on command and then went back to sleep. She was admitted for respiratory failure and altered mental status. She was initially placed on BiPAP and then intubated. Her husband had reported that the patient has been confused, throwing stool from her colostomy bag and smoking heavily. He also reported that since her discharge from the rehab center, patient has been ambulating poorly, appears to be over-medicated, and to be more stooped over in the past couple of weeks. He reports that she has been dropping things and often finds multiple pills on the floor and in the chair she sits in, but does not know what these medications are used for. He reports that she drinks about a half a bottle of a pint-sized amount of wine per day. He states that she has a history of alcohol use and cigarette use and multiple admissions to rehab centers. But this last month she's been worse since she's been discharged from the rehab center. She does have a home health nurse who visits 2 times a week. And she said that the patient was discharged from Kingston recently, and reports that the patient is usually slightly lethargic, but is always alert and oriented to person, place, time, and situation. She stated that the patient is usually independent with daily activities. The home nurse said that whenever she went to the patient's home, she found that the patient was sitting with each colostomy bag off. The areas around the stoma was red, bleeding, and her clothing was covered with dried feces. She said that the patient just seemed off and not her normal self. So she was transported by EMS to UTMC ER and admitted. Her current medications are Buspar, Ativan, Zoloft, and Depakote. She has a history of bipolar, alcohol use, tobacco use. She's had multiple surgeries. Axis 1, major depressive disorder, bipolar disorder, and substance use disorder. Axis 2, deferred. Axis 3, delirium, COPD, CHF, colitis, and cirrhosis. GAF score of 30 to 21. She has serious impairment in her communication and judgment. She stays in bed most of the day. She has no friends, no job. And then our plan is to start a CWA protocol due to her possible alcohol and benzo withdrawals. Continue her Zoloft, continue her Depakote, continue her Buspar, and then continue her home Ativan, and also her home Ativan PO we're gonna just change to an IV dose as needed for agitation, and her benzo withdrawal. And that is it. Thanks.